Hi all, my name is Dr. Omer Ibrahim. I'm with Chicago Cosmetic Surgery and Dermatology. I'm a board certified dermatologist, cosmetic dermatologist as well, and I do a lot of research here as well. So we asked you a whole bunch of questions, or you asked us a whole bunch of questions on Instagram and Facebook, and so now I'm going to go through the questions in random order, and I'll try to answer them best I could. So, first one is from Katie Ann. Thanks for your question. So, in a recent post on your personal page, you helped a man with balding using at-home medical grade products. Can you tell us more what those medical grade products were and tell us a little bit more about those injections? And do you also recommend Nutrafol? Some of my clients have asked me about this product. So first, the at-home regimen for men, it entails several sort of medical as well as prescription strength treatments. So the first thing I usually like to prescribe for my men is the dreaded R word, Rogaine, or minoxidil. Rogaine is the brand version. Minoxidil is the active ingredient. What minoxidil does, and it's available over the counter as well as prescription strength, so higher strength versions. What it does, it increases blood flow to the scalp, and somehow we don't really understand how it works, but it actually blocks those genetics and those hormones that are attacking your hair follicles. It actually protects the hair. I treat Rogaine or minoxidil like anti-aging for the hair. If you notice any sort of hair loss or hair thinning, start on it every single day. Hair ages just like skin ages. So I say start it as soon as possible, as soon as you notice hair thinning. The other medical product that I use for men a lot is finasteride or Propecia. Propecia is a treatment that is used to sort of, again, block the testosterone that is attacking your hair follicles and causing your hair follicles to shrink and sort of die over time. Now, you also asked about the injections. So injections, those are PRP injections, and that actually relates to another question that we got. PRP stands for platelet-rich plasma injections, and it's used in all types of hair loss, anything from mild to severe. It actually works better in the more mild to moderate types of hair losses. It's a procedure where you come in the office and we actually draw up your blood, believe it or not, spin them down, extract your stem cells and your platelets, and actually inject them back into your scalp. Sounds barbaric, but I promise you it is not. I get the procedure done myself. It is slightly painful, but it's one of the latest and the greatest treatments when it comes to treating hair loss. Now, I tell my patients all the time, day in and day out, that gold shiny and new does not replace gold standards. Gold standard treatment is finasteride, Propecia, spironolactone for women, but it does not replace gold standard treatments, but it is a great treatment for regrowing and rethickening and reinvigorating hair. And finally, Nutrafol, do I like it? Yes, I like it as a hair loss supplement, especially for those patients that want to avoid hormonal treatments like finasteride or Propecia. It's a good sort of natural alternative to that. Okay, so let's move on from the topic of hair loss, hopefully. Let's pick the next one. This is at HollyK24. I really like this question. So this question's asked about at-home microneedling rollers, and is it safe to use, and if so, which one should I look at? So when you compare microneedling treatments from the office to at home, I really don't recommend at-home microneedling, and I'll tell you why. Because the FDA does not allow you to use anything at home that is going to puncture your skin. So you are just giving yourself sort of a painful massage at home. You need to puncture the skin, and that's only done with medical grade in-office microneedling. They're longer, they're sharper, they're sterile, which is a huge point, a huge factor. They puncture the skin and they cause collagen remodeling, collagen rejuvenation, fight lines, wrinkles, pigmentations. Acne scars helps with all of that. You cannot get that kind of treatment at home. In fact, sometimes the at-home ones can shear and dull, and they're not properly disinfected between treatments, and it can actually lead to infection, and that's another concern of mine. That's why I don't really recommend at-home microneedling, because one, they don't really do much, and two, you can lead to infection and scarring and things like that, so leave it to the medical professionals is what I say. Okay, I like this question from Dr. Sarah MD. So first question, if you were stranded on an island besides sunscreen, what else would you bring? I would bring I would bring medical grade vitamin C serum. That's one of my favorite sort of morning serums. One of my favorite ones, there's all kinds out there. One of the ones that is the best sellers in our office is Revision it's Revision C Plus Correcting Complex. It's a 30% vitamin C with a whole bunch of other botanicals that are fantastic in sort of helping with fine lines, wrinkles, and pigmentation. One of my absolute favorite vitamin C serums. I always tell people pick medical grade vitamin C vitamin C serums because they work better than things you can get at Sephora and things like that. All right, second question. This is a very controversial question. What is your favorite Britney Spears album? So my favorite Britney Spears album, and quite arguably the best pop album of all time, is Britney Spears' Blackout. There's no question. My friends are gonna kill me for that one, but look it up. Okay, next question. At Complexion Me, your favorite filler of choice for sculpting the jawline. My absolute favorite filler. We here at Chicago Cosmetic Surgery and Dermatology, we have all kinds of fillers. Pretty much every U.S. FDA approved filler in the U.S. But my favorite jawline filler is Radiesse. So Radiesse is made out of a product called calcium hydroxyapatite. It pretty much, people on the street call it liquid bone because it gives such firm lift. It's wonderful for lifting the jawline. For my first timers, I usually don't go with this for my first time filler patients. I start with a hyaluronic acid based one because if for any reason you don't like the filler, which hardly ever happens, but if that does happen, we can dissolve it on the spot. And then for my more seasoned filler patients, and they're like, I trust your aesthetic, I trust your technique, let's go with hard hitting stuff, then I use Radiesse for the jawline. My male and female patients absolutely love it. Okay, next question. So best laser treatment for rosacea. So when you think about rosacea, there are different kinds of rosacea, but what I'm assuming this question, this is from @tags, by the way. What I'm assuming this question is referring to is the redness, the flushing, the blushing, the broken capillaries. That all comes with rosacea. So the best treatment for that would be the XLV laser that we have here. It is a laser that selectively targets bright red blood vessels. It helps reduce redness that's induced by certain types of foods. It helps reduce and shrink those broken capillaries and gets rid of them. Another laser that does that as well is the pulse dye laser or the PDL laser. They both work in similar ways. The XLV laser that we have here is one of our workhorse lasers and patients absolutely love it. Alrighty, so going through the rest of your questions. So how long do fillers last from @veronica.doc? How long do fillers last and how often should they be done? So fillers last, hey Jeff Sue, sorry, just wanted to say hello. Fillers last quite a while depending on where you put them. So around the lips, I would say about 9 months or so, because this is an area that moves more often. In the jawline, and depending on the filler that you use, whether you use Voluma, Restylane Lift, or Radiesse in the jawline, it can last up to 1.5 to 2 years. Radiesse might last even 2 to 3 years. In the cheekbones, it's anywhere between 1 to 2 years. And under the eyes, they used to say, it only lasts 9 to 12 months, but filler under the eyes can last up to 2 to 3, even up to 5 years. They've actually shown and done studies where people got filler under their eyes and then 5 years later they had to have surgery or facelifts or something like that, and they actually found old filler under there. Not necessarily dangerous, not a bad thing. It's good to get longevity for the fillers that you want. Just make sure when you're looking at getting fillers, you not only ask what the price is and what it costs, you have to ask, does the person know what they're doing? Is the person trained in doing what they're doing? And also, it depends on not just the area you're getting it, the filler, the injector, a lot of factors other than price. So you have to make sure you go to the right person. And how often to get them done really depends on you. Lips or so, about 9 months, every 9 months or so. Cheekbones, jawline, probably once every 9 to 15, 18 months. I think that's a good sort of ballpark. All right, next question from Maureen. What is the best way to increase or restore volume to your face as you're losing weight? So this is a really great question. So when people lose volume to your face, and if you were on Instagram or Facebook, the whole before and after of Adele is trending. She lost a whole bunch of weight, and so with that, a lot of her facial volume, it looks like she aged 10 years over a year. Love Adele, nothing against her. You go, girl, do what you need to do. But what happens is when you lose fat from your body, it goes with your face as well. And this can unfortunately make you look older, make you look more tired, make you look more sunken in. So I recommend to patients going on a weight loss journey and they're noticing sort of this gaunt look. I recommend that they actually get some filler injections. So fillers there's different kinds of fillers. One's for the under eyes, one for the cheeks, lips, jawline, pretty much the temples. You can even fill the forehead. So you have to sort of balance your weight loss with healthy facial rejuvenation filler injection techniques. And we have a question asking, do I use cannula for injections? I certainly do, depending on the area. Some areas require needle because you have to get much deeper and much more precise. Some areas require care and finesse, like the under eyes, where I like to use cannula. But regardless of needle, cannula, regardless of the filler that you use, you definitely need to invest in some sort of filler if you want to restore some facial volume loss. All right, we'd have just a couple more questions left. I'm going to grab the rest of them from here. Elizabeth Janice, can someone with minimal hair loss receive PRP? And this was answered earlier, but yes, PRP or platelet-rich plasma injections. Someone with minimal hair loss can definitely get PRP. It actually works better in sort of the mild to moderate cases. Good question on pregnancy. So we got several questions on what you can use during pregnancy. So at Carly Swank, she asked, how long before pregnancy should you stop using adapalene? And are any acne treatments safe during pregnancy? So one, I usually tell my patients, as soon as you find out you're pregnant, or if you're looking out for pregnancy, as soon as you find out, you can stop the adapalene and it's totally safe. Are there any acne treatments safe? So yes, so I tell them as soon as they find out you're pregnant, stop your retinoids or your retinols, call me and we come up with alternatives. Alternatives are sulfur washes, benzoyl peroxide creams, lotions, or washes, clindamycin, which is available through prescription, of course, erythromycin, and azelaic acid. These are all options that we use in combination of one another, and glycolic acid as well, in combination of one another to brighten the skin and also to treat acne as well as acne scarring and things like that. In terms of procedures, you can definitely do PRP while pregnant or platelet-rich plasma under platelet-rich plasma. You can also do laser resurfacing when you're pregnant. You just want to stay away from the injectable treatments, but procedures like microneedling with PRP, like lasers, all safe during pregnancy and not a problem at all. And other topicals that I previously mentioned are great for scarring as well. Someone asked, what is your favorite under eye filler? Hi, Smila. Someone asked, Smila asked, what's your favorite under eye filler? And I prefer Restylane. It's actually one of my favorites. It's soft and it's great for the under eyes. And one of my best friends at Chris Lee. Hi, Chris. What is the most effective way to treat hyperpigmentation and scarring in dark skin? That's a great question. The best way to sort of do that is a combination of treatments. When we look at scars, we look at their color and we look at their texture. So when we're treating coloring of the discoloration or the hyperpigmentation caused by scarring, we use hydroquinone, which is a lightening cream. It's available over the counter in products like Ambifade, or it's available prescription at higher strength, of course. We also use chemical peels to help with the pigmentation. When you look at the actual acne, sort of if they're atrophic or if they're indented, and you're treating their the actual indentations and the textures of the acne scars, then you have to sort of look at other procedures, in-office procedures like microneedling with PRP, lasers. Yes, lasers are safe in darker skin. You just have to go to someone proficient in using them on darker skin. You don't want to overdo it because you can cause pigmentation in darker skin with lasers. But for sure, you can use lasers, microneedles, chemical peels, as well as at-home treatments to brighten the skin, but also build collagen and help improve the appearance of scars. You'll never erase scars completely. There's no technology that does that, but you can improve their appearance significantly. All right, we have one last question, and this is from SG Photos. What determines how many sessions of Kybella are needed? So for this last question, I'm going to explain a little bit what Kybella is. So Kybella is deoxycholic acid. It is an injectable fat dissolver. It is a permanent fat dissolver. I tell patients wherever there is fat, Kybella is most likely to work. It is FDA approved for this under double chin area, but I've used it in older patients, men and women, for their jowls. I've used it for excess back fat or bra fat. I've used it on the thighs. I've used it on the lower abdomen, all with success. But what determines how many injections you need and how many sessions you need? I tell patients, one, you have to look at the studies. The studies tell you that you need at least 2 to 3 treatments, period. I have patients that come in and they're like, I want 1 treatment. If they couldn't get 1 treatment to be a one and done in their studies, I'm not going to be able to do it in real life. So you have to expect at least 2 to 3 treatments. And then what determines 2, 3, or 4 treatments depends on your skin laxity, how healthy your skin is. The younger, more tight skin tends to respond better. How much fat you have, of course. If you have more fat, you need more Kybella treatments under your chin or wherever we're treating. But for the most part, I tell people bank on 2 if we're being super conservative, but on average, most people need 3 treatments, and each treatment is separated by 8 weeks. They used to say wait 4 weeks between treatments, but it's no longer viewed as 4 weeks because we can tell the medication still works for a good 8 weeks. You do 1 treatment, wait 8 weeks, do a second one, and so on and so forth. Well, that's it for my questions. Thank you all for all your questions. Make sure to follow us at Chicago Dermatology. Follow me at Chicago Skin Doc. This video will be going, I think we'll be downloading it and it will be uploaded a little bit later, so you'll be able to rewatch it. And hopefully we'll be able to do more of these soon. Have a good day.